why do you have such a negative view on medicine? I think that's a great question. And if I'm being completely transparent, I do have a negative view on medicine. And I was thinking about it. I used to not have a negative view on medicine. I think prior to becoming a nurse and having a wife that was pregnant and doing all this medical research that I've done just kind of on the side, I used to not have a negative view on medicine. So I'm going to try to explain why I have a negative view on medicine. And Apostolia, if I'm saying your name right, I think that might just be your YouTube handle. I'm going to just try to list everything. I've tried to record this video a few times. I'm like, oh my God, I go off on so many tangents. I was like, no one's ever going to want to listen to this. So let me list for you just like some big reasons why I have a negative view on medicine. The first reason that I have is there is someone by the name of Peter Gosh. I'm going to butcher his last name, but he's a statistician. He used to be, I think, the head of the Cochrane Institute. They do a lot of meta-analyses and systematic reviews looking at medical literature to see if what we're doing is really evidence-based. And one of the things that Dr. Gosh said is that one of the leading causes of death, I think it's the third leading cause of death, is medicine. I think we label it as like accidents maybe here in America, but when you look through the statistics, medication is the third leading cause of death. And we could go more into this, but I need to list my reasons. Otherwise, I'm going to go off on a tangent. So that's my first reason. My second reason is there's a Harvard-based statistician, or maybe Stanford. His name is John Ioannidis. He came out with a research paper maybe 10 years ago that stated that 80% of medical research was bunk. And I want to talk about this too, but I'm going to go off on a tangent. So let me come up with my third reason. My third reason is all the research, medical research I've done by looking at peer-reviewed research. And after investigating a standard protocol or intervention that we use commonly, found out that maybe it's not the best thing for us to be doing, or maybe it's not necessary. I want to give a quick example of this. One of the things I found out with my wife was there's something that's called intermittent fetal heart monitoring, or maybe it's continuous heart monitoring. I can't remember it, but basically when a woman goes in, she's pregnant, she's going to have labor in the hospital, they put this strap around her belly and there's this little nodule on there that listens to the baby's heart rate. Well, they found out in healthy pregnancies that by continuously monitoring this, it often leads to unnecessary interventions, which then complicates the pregnancy. So I just wanted to give that quick example out there before I forget. And I think it's still done in some hospitals. They still do continuous fetal heart monitoring, when in reality, I think the recommendation, if I'm remembering right, is it should just be intermittent. For those of you out there who don't know, by the way, like when you listen to a baby's heart, that can be a sign of distress. So if the baby's heart is fluctuating and that fluctuation isn't what should be happening, then perhaps the baby is losing oxygen, perhaps there's something going on with the umbilical cord, etc. The fourth reason I have a negative view of medicine is because of big pharma's influence. And I put big pharma in quotes because I understand there's this kind of derogatory, conspiratorial association with big pharma. I'm not like that really whatsoever. It's more of the evidence that I look at when it comes to big pharma and some of the things they've done when it comes to mismarketing and fraudulent activities, and some of the research that they will obscure, they will hide, or they will admit in their clinical trials, and the fact that so many big pharma companies have been sued for millions and millions of dollars and have lost the lawsuit or have settled for millions and millions of dollars. That really makes me skeptical of medicine. Why? Because, well, big pharma is a huge funder. They're the ones that come up with the medicine. And so that's another reason that I have a negative view on medicine. A fifth reason, and I feel like this probably should have been my first reason if I were to label them in levels of importance. I guess my first reason is, as I just believe the human body has an amazing capacity to heal and to self-regulate. And I feel like medicines often disrupt that, and we can over-medicate people so much to the degree that we have no idea what's going on in their bodies. And I remember we had one patient at the state hospital. He was taking like 17 medications. And I'm thinking, how do we know if any of his behavior, if any of the organic processes going inside of his body are occurring as they should, because he's taking so much medication? I mean, that is an absurd amount of polypharmacy. And I typed in all of his medications in this clinical pharmacology drug interaction software, and the amount of interactions I got, it was just like overwhelming. I was like, sweet mother of God. And so not to go off on a rant here, but if we're given proper nutrients, diet, exercise, relationships with other people that are very healthy, and we're in an environment, a physical environment that's conducive to our well-being, I think the majority of of illnesses, medical illnesses, psychiatric illnesses would just disappear. They would go away. So that's another reason why I kind of have a negative view on medicine. And there's nothing wrong with medicine. Medicine in and of itself is like anything in life. It depends on a relationship with medicine. I guess the reason I have a negative view is because I feel like we, especially here in America, we view medicine as this essential thing. It doesn't have to be this essential thing for most of us, right? For some people that are. And I feel like medicine is kind of like drugs. Like, I don't think drugs are inherently bad. And that includes psychotropic drugs, antipsychotics, things like that. I really feel like it depends on our relationship with the drug and why we use the drug, or why we use the medicine, or why we use a particular medical intervention, etc. I just feel like there's this heavy reliance on medicine here in America. Like, you're not normal unless you take a medication. I mean, we've got a pharmacy on freaking every block, it seems like, every corner of every block. And I feel like we just generally medicate. So that's why I have a negative view on medicine. I also think, like, when our kids were being born, I was researching a lot of the vaccines. Like, I have a hard time understanding why we would give the hepatitis B vaccine to a brand new newborn. I cannot really come up with a strong justification for that after doing all the research. Another thing that I had a hard time with was the vitamin K shot. It's one of those fat soluble vitamins that's administered intramuscularly, usually into the thigh of a newborn, to prevent a very rare occurrence where a kid starts to just kind of bleed out internally. Vitamin K is a clotting factor. So the hypothesis is that if you give this vitamin K, and the research does seem to support it to a certain degree, that if you give vitamin K to a child, it will stop this rare possibility of internal bleeding. And I came across one study, I'm going off on a little bit of a tangent here, but I think it was like maybe it was in Ethiopia, where they give the standard IM injection for vitamin K for newborn here in America is 1 milligram. There's some other countries that do it orally, but there was one country that gives 2 milligrams, and yet they still had a much higher rate of vitamin K deficiency bleeding than we do in America. And I'm like, well, where's the explanation for that? If vitamin K helps with clotting, why is it that this other country out there who gives 2 milligrams, why do they have such high rates of bleeding? And that I never really found an answer to. All right, so without going into too many tangents, I want to get on to the rest of your comment. You said, why do you have such a negative view on medicine? It is odd for someone in the mental health field. That is more or less true. I've run into a number of people who are somewhat skeptical of medicine while working in the mental health field. I feel like it's probably like 80-20. 80% of people feel like, yes, the conventional stuff is what we should be doing. Then there's the other 20% who kind of fall in a different category. I think if medicine can be avoided, it should be. I don't like medicine. I agree with you there, but I would never say that it drains the soul out of all people. And I think in this video, I'm forgetting which comment this video came from. It's probably one of my videos on antipsychotics where I feel like it does drain the soul out of people, kind of takes the essence out of them. And I guess I would say for antipsychotics, like, I'm not 100% against them. I'm glad we have them, which is what I've stated in other videos. I just feel like we overuse them, and there's certainly some people out there who have absolutely benefited from antipsychotics. So I'm not like Peter Bregan, if you know who he is. He's a psychiatrist who's anti all psychiatric medication. He feels like it should all be abolished. I'm not that extreme, although I appreciate Dr. Bregan. I think he's an amazing man. I feel like there's more of kind of a happy middle ground where we could probably use the Pareto principle, if I'm saying that right, from 80-20. We could probably cut out our medication use by 80%. And I don't know where I'm going with this, but I feel like we could just not use antipsychotics as much as we do. And that, yes, some people have benefited from the antipsychotics. I think, I want to get back to your comment, you said, I think what you said applies to those that are heavily or improperly medicated. On that point, I would slightly agree with you. At the same time, I feel like when anyone takes almost any dose of an antipsychotic, like any standard dose, there is a part of their essence that is kind of taken away. There is a part of their spontaneity is taken away. A part of their vibrance as a human is taken away. And it's probably in proportion, as you kind of alluded to here, to the dose that they're taking. So the higher dose that they're taking of, say, Zyprexa, the more of their soul is going to be sucked away. The less dose they're taking, the less of their soul is going to be sucked away. But for some people, you know what? I guess you could also argue, and I've seen it in a small amount of people, where that Zyprexa, that antipsychotic, changes them so much that it's for the better. It is for the better, and it's almost like a soul has been added to them. They've got their soul back. So I want to be fair. I don't want to say that antipsychotics should never, ever be used. I would never say that. I think that's absolutely crazy. And I've given antipsychotics where I'm like, thank God I've done it. But in that video, I may have left some people with the impression, especially if they don't watch the video, and I don't know how long you watch the video for, but if sometimes I won't say things that are positive about an antipsychotic towards the end of a video, and so some people may be left with the impression, if they're leaving the video without watching in its entirety, that I'm completely against antipsychotic medication. I'm not. And then Apostol, you said, I took antipsychotics and I felt a lot better personally. And I'm like, dude, that's awesome to hear. I wish everyone had that same statement and same experience. My mom said I was flatter than usual. Very typical response from family members. I'm saying this to be completely transparent. Thank you for your transparency, but I personally didn't feel that way. I felt a lot better. I think it's amazing that you feel a lot better, and I'm happy that you feel a lot better. And I think we have to be very careful about anecdotal evidence, because you may feel a particular way and you feel that way, which is great. Some other people will take the medication, they're not going to feel that way. And I can tell you as a psych nurse, after having very intimate conversations with patients whom I feel like trusted me, so many of them told me that they just hated their medication. Now, a lot of these patients were on involuntary medication, so that could be an aspect that would kind of biases our results. So I would say that in a forensic setting, I can tell you that a lot of patients just straight up hate their medication. Again, that's because a lot of times they're on involuntary medications. They're having to take their medications. So those statistics might be different from people who are not having to be on involuntary medications but are voluntarily taking a psychotropic medication or an antipsychotic medication. Another thing that just popped into my head that we have to be curious is, I can drink an alcohol. Well, now that I'm a lightweight, I can only drink probably one beer rather quickly before I feel a pretty good buzz. But if I drink like 4.5% alcohol, right, and I get that nice buzz, I can tell you I feel a lot better. Does that mean that I should be taking the medication? Not necessarily. And we have to be careful, because when we take these psychotropic medications, alcohol, antipsychotics, antidepressants, they affect the way that we think. They alter the way that we feel about ourselves. They alter the way that we think. And so that medication that we've taken has altered our ability to, what am I trying to say here? To assess how we're actually feeling. So I might take 2 beers, right? I'm like, man, I feel freaking great. But in that state, that is my state that's under the impression of alcohol. So that's not my authentic self saying that. That is the alcoholic state of my brain. I'm just butchering this. I cannot talk today, but hopefully you get what I'm saying. I don't want you to take this wrong, by the way, or personally. I'm not saying that your medication's not benefiting you. It really seems like it does. At the same time, we have to be careful, because anytime we take something that affects our brain and affects the way that we may be able to assess ourselves, we have to wonder, is my assessment of myself as objective as it possibly can, or is this medication affecting my judgment? And that's something Dr. Bragan, if you ever look up him, he calls it the medication spellbinding effect, where people who have had a procedure or a medication often feel like it's benefiting them. There's also probably a little bit of like placebo going on. So it's just something to be aware of. When you're obviously a very compassionate person, I haven't always been. Sometimes I lose my compassion, and sometimes I have to like work hard to get it back. But I do feel like as I've aged, I've become much more compassionate than I used to be. I don't mean to shit on you at all. I don't feel like you shat on me at all, brother. I appreciate this comment. This comment has been awesome. I'm more asking to see what your stance really is as a professional. And I appreciate your comment. And I welcome comments that are completely in diametrical opposition to whatever I may say. I feel like that is the healthiest way for all of us humans to go, is just like accept every opinion out there and then look at the merit of that opinion based upon the evidence. But don't shy away from everything. Like, you could take a flat earther. I don't know enough about geography or astronomy to even have really opinion, but I would be willing to listen to a flat earther despite me having this initial impression like, hey, that person over there is crazy. Like, that's a crazy idea. But even though I can recognize that that person might be crazy, I have the intellectual maturity to just temporarily hold that belief I have about that person in a little compartment up here, where I can just be like, I'm going to set you up there for now, and I'm going to genuinely listen to what this person has and what their beliefs are and why they believe it, what their evidence is, and then I'm going to come about a conclusion. And I think as humans, that's where we really need to go. And I'm getting like choked up here, because I've seen so much stuff lately of people who don't want to listen to any other side. I'm like, just abstain from your belief. Just put your belief aside and listen to what a person has to say. How did they come about that belief? Why do you believe that? What would change your belief about that? And that's an important question. I think anytime we have a very strong belief about something, we need to ask ourselves, what would change that belief? And if nothing would change that belief, then maybe it's a belief we shouldn't have. Or if we're talking to someone, we ask them like, what would change your belief? And they don't seem like there's anything that would change their belief, then we know, well, maybe that belief is not really evidence-based, which isn't to say that their belief isn't true. You could have a true belief that has no evidence to it whatsoever. You just kind of lucked out that belief is true. But at the same time, we would know, okay, well, that belief is not well researched, and it belongs pretty much nowhere in medicine. In medicine, I think more or less we need to let evidence guide our beliefs. And I also understand that it's very difficult sometimes because of conflict of interest, because of money. It takes a ton of money to fund a phenomenal randomized placebo-controlled trial. It takes a ton of money to find the participants, the research subjects, etc. Then there's ethical considerations. Like, there are so many barriers and boundaries to funding great research that I kind of understand why pharma has a big influence on it. But I'm starting to rant now, so I'm going to shut up. And I hope you found this video helpful. And thank you again for the comment. I appreciate it.